Hi everybody, I'm here today with Jenny and we're going to be talking about IVs, the basics of IVs, who might benefit from IV therapy, and personalizing IVs to you. So let's get started. Do you want to tell us a little bit about the basics of what IV therapy is and maybe some signs that it would be useful or helpful to somebody?
Sure. So IV stands for intravenous. So intravenous therapy, meaning you get a needle, the needle comes out, and you have the catheter left in a vein in your arm. And we do what's called peripheral IVs, meaning that it's in your arms. It's not central. So why would you want one? Why would it be helpful? So a couple of different reasons. For some people, they have absorption issues. So people who have had gut surgeries, like intestinal surgeries, or they have an illness like Crohn's disease, they have issues absorbing nutrients and water from their gut. And so when you do an IV, it's going into the bloodstream. So there's no second pass, is what it's called. It doesn't have to go through the gut to be absorbed. It's also good for people who had bariatric surgeries because they have, again, less of their gut, so they have harder time absorbing things. And then there's for other people who, when they become ill, especially GI issues, gastrointestinal issues, and they have the vomiting and the diarrhea, they just lose so much water and it's hard to rehydrate yourself back up. So getting an IV kind of helps put that over. And then there's healthy people who just want to do regular maintenance and preventative health and stay healthy. A lot of people like to do it for when they go flying, if they're traveling, because people, when they travel, don't drink enough water at all. So it helps if they hydrate prior to and get some vitamins as well. And it just helps to have a, better trip or whatever. And there's also, with IVs, you can also treat certain things. With micronutrition, the vitamins, the minerals, we don't call it treatment, and it's not a cure, but there are types of illnesses that can be treated with certain medicines or vitamins, like we even we'll treat like headaches. So you can get IV medication along with your fluids.
Another really important question that I wanted to ask you was would I know what kind of IV to get for my personal needs, and how do you decide what combinations of vitamins to give to people that come in for an IV?
That gets asked a lot. So how I do it, and shameless plug, how I pretty much do everything here, is instead of the person saying, I want this, I ask them, like, what do you want from it? So if someone says, I've been sick for the past 3 days, I'll pick from that, usually a hydration. If they are trying for something, like they want an immunity booster because they're traveling, then I'll go that route. If they're ill and they need medications, then I'll go that route. I also do a complete history, so I know what kind of medical issues they have and what kind of medications they take and what kind of supplements they take on a regular basis and what allergies they have, because even with micronutrition, it's really important to know all those things, because there can be bad interactions if you don't do that.
That's really good. That's awesome. So what can me or anybody watching expect when you come in for an IV appointment? How long does it usually last? What does it feel like? What does it entail?
So when you come here, you get your vital signs taken, so blood pressure, pulse rate, oxygen saturation. If it's a first time, you'll go through the whole history with me. If it's not your first time, then we're old friends by that point. We'll decide what you're getting, and then you get the actual IV, which is just a little stick. I have the ER background, so I'm like an AC kind of person. Yeah.
Okay.
Like different types of nurses have different places that they like to go. But us ER folks like the AC. So after that gets established, the IV itself, usually depending on how the vein is, it's usually you plan for an hour from start to finish. Some people it goes in really quick. Other people, it's a little bit slower. With elderly people, I tend to go slower. If there's certain comorbidities, like that they have less fluid, then they get less fluid slower. And then there's certain infusions like NAD, which is like a 2-hour infusion. So it all just kind of depends. But I would say like plan on an hour.
Okay.
Oh, and it can also get very cold. So the fluid that's going in, it's room temperature. And our bodies are like 98 degrees. So it can be a little chilly. So we have heated seats and blankets to go with.
Very cool. My next question, kind of in that vein, is how long does it take to feel the effects? Do you feel it right away, a couple minutes after, hours, days? And how long will this usually last for? I guess also it depends on what kind of treatment you're getting.
Yeah, totally depends. If you if you're coming in for like an illness and you're getting medications, IV medications you feel pretty quickly because it gets delivered straight to your bloodstream. So those effects come on pretty quickly. So if you're getting like Zofran for nausea or Toradol for pain, or Ketorolac for pain, those you'll feel pretty quickly, like minutes, to start feeling the effects, and then it takes like a little bit longer to get the whole effect. If you're dehydrated, people usually feel the hydration pretty quickly as well, like by time the infusion is done. As far as like vitamins, those usually take probably the next day before you start to really feel them, but they're in your system, but you don't really feel the effects until the next day. And some of them are longer. So like the NAD, if you're doing like a series of NAD, you're not really going to feel much until like a few infusions later. But so it can be almost immediate to like a little bit longer, depending what you get.
Very cool. Okay. In terms of preparing for pre or post an appointment, do you have any recommendations for things that people should do or even avoid right before or right after an appointment?
100%, yes. Please drink water. So whether you're getting an IV or you're going for a blood draw, anytime someone has to hit a vein, if you are already dehydrated, it makes it harder. So if you know you have small veins, like please drink water. That's probably the biggest thing. Maybe avoid NSAIDs, non-steroidals, which are like Aleve, Advil, those kind of things, because they can, aspirin, because it can make you bleed more. Make sure you let them know, whoever's doing it, that if you're on a blood thinner, because you'll bleed more. And then for the post, it's afterwards, you really just want to make sure most people stop bleeding like right away. But again, if you're like on a blood thinner, it might take a little bit longer. So you want to just apply pressure, and then I don't know, that's pretty much it. Like you're good to go afterwards, really.
I didn't really think about the vein part. I was just thinking more about like the nutrients itself. So that's some good insight, because I didn't think about that at all.
Oh, and another important thing would be if you're having surgery. So there's certain vitamins that you don't want to get like for a week before surgery.
Right.
So make sure you plan ahead for that.
All right, good to know. Do you have any final statements or thoughts, advice to someone who's considering getting an IV for the first time?
Definitely drink water. Make it easier for all of us. But also make sure you know where you're going and who is deciding what you get. So there are some places that are more cookie cutter, and there are some places that will be more personalized. So here there will always be a provider. So you need to have a provider kind of give the order. So if you have a provider like on scene, then you can mix and match and probably pick what you want, as opposed to like picking something off a menu. definitely know where you're going. Also, here, I think, have a little leg up because everyone that works here has ER experience. So that means that everyone who does an IV here has done literally thousands of IVs and very difficult IVs. So chances of getting it are pretty good. Yeah.
All right. That's all I have for you today, but you heard it here. IVs are great. Hydrating, a lot of benefits, and can be personalized to your specific needs. So,
yeah.
Yay.
Yay.